Hi everyone, I am Mary with Mary Greeley News. Thank you for joining me. It has come out today one of the side effects of the COVID vaccine, swollen lymph nodes. It mirrors breast cancer in x-rays and people can feel them underneath their arms. Doctors are sending out the word that these swollen lymph nodes are a side effect because of the antibodies developing in our body for the COVID virus. You may not even know you have the swollen glands, but they do show up on x-rays. According to an article on Fox News, a doctor they spoke with, Mr. Marshall, said they have seen swollen lymph nodes in patients with breast cancer, so that is a concern here. So we are asking everyone who is having a mammogram if they had the COVID vaccine. Marshall says that UH Radiology and Breast Cancer Imaging Department has received increased calls from women concerned over the signs, noticing that they got this swelling. It means that the body is making antibodies to fight the COVID-19 infection, said Marshall. According to data from the CDC, over 11% of vaccine recipients experience swollen lymph nodes after one dose, and 16% do so after a second dose. Evidently, so many cases they're now seeing, they're claiming this is a normal response. But you have lymph nodes in other parts of your body. An example, your stomach. I found an article about the swollen lymph nodes in a boy who was later diagnosed with coronavirus, even though several tests had come back negative. The boy was initially misdiagnosed as having mesenteric adenopathy. This research paper states that coronavirus disease 2019, COVID-19, can present with abdominal pain in children and adults. Most imaging findings have been limited to characteristic lung findings, as well as one report of bowel ischemia related findings in adults. So I wanted to find out more about the swollen lymph nodes of the stomach, and here it says that the mesentery is a fold of the membrane that attaches to the intestine, to the abdominal wall, and holds it in place. Lymphadenitis is a condition in which your lymph nodes become inflamed. So this young man, this boy, was initially diagnosed as having something that turned out to be caused by COVID. Initially, it progressed to severe illness requiring intensive care before complete recovery. The boy tested negative for COVID-19 twice from upper respiratory swabs. Before sputum, PCR resulted positive. The case report says a generally healthy, immunized, non-obese, white, 17-year-old boy presented to an outside emergency department with 3 days of initially moderate progressing to severe abdominal pain, focused in the right lower quadrant, a fever of 103, vomiting without diarrhea. At the onset of the hospital, the white blood cell count, all the testing was unrevealing. All the other tests did not suggest the boy had COVID-19. He was discharged with instructions for supportive care and close primary care follow-up with the diagnosis of mesenteric adenopathy. 2 days later, he went back to the hospital with worsening abdominal pain and persistent vomit. He had also developed a productive cough and severe headache. He developed hypoxemia requiring non-breather mask and was admitted to the pediatric intensive care unit. A repeat nasal swab for the SARS-CoV-2 testing was negative. Because of the worsening hypox respiratory failure and the suspicious lung CT finding, they performed a repeat SARS-CoV-2 PCR on the sputum. and that test came back positive. That poor kid had probably been sick for about a week. Even a stool sample came back negative for having the COVID. So I guess we have to add swollen lymph nodes to the list of symptoms of COVID. Fever or chill, cough, shortness of breath, or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, runny nose, nausea or vomiting, and diarrhea. It says to get emergency medical care if you have any trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. So I wonder how many doctors don't know about the swollen lymph nodes, and these women go through the fear of having breast cancer when to come to find out it's actually the COVID virus. And now the vaccine that is given to women is causing the same symptoms. So what are your thoughts? Put your comments down below. Thank you for watching. Don't forget to subscribe. Please stay safe, and I'll talk to you later. God bless y'all.